Okay, good morning everyone. And since you're on the phone, I'll just get right into the numbers. So this is Teresa. So today we are reporting 170 new cases of COVID-19 in Windsor and Essex County. 16 cases are related to outbreaks, 6 are household contacts of confirmed cases, 2 are community acquired, and 146 are still being investigated. We continue to reach out as quickly as possible to advise people to isolate. We reached 94 people yesterday and 46 so far today. We've had 8,676 cases since March. 6,195 cases are now resolved, and we have 2,464 cases that are active. 92 confirmed cases are currently in the hospital and 15 people are in ICU. There are 176 suspect cases of COVID-19 in our hospitals as well. Today we are reporting an additional 17 deaths. 14 deaths are from long-term care and resident homes. A man in his 70s, 4 women and 2 men in their 80s, 4 women and 2 men in their 90s, and a woman over 100 years old. 3 deaths were also from the community, a man in his 70s, a man in his 80s, and a woman in her 90s. We have now lost 187 people to COVID. 122 deaths have occurred among residents and staff in long-term care and retirement homes. There are currently 43 active outbreaks in Windsor and Essex County. 20 are in long-term care and retirement homes, 16 in workplaces, 2 in schools, 3 community outbreaks, and there are 2 hospital outbreaks. We're continuing our vaccination of residents, staff, and caregivers of long-term care homes, and we're doing an additional 2 homes today for a total of 9 homes so far. And I think that's it for now, and I'll turn it over to Dr. Ahmed.
Good morning and thank you. So building up on what Teresa said, Windsor-Essex County has lost 187 people as a result of COVID-19, and almost every day we are reporting COVID-related deaths, and my heart goes out for all the families who lost their loved ones. I cannot imagine what these families are going through at this moment. My sincere condolences to all the families who lost their loved ones. Overall, when we are looking in Canada, we have lost 16,233 people as a result of COVID-19. And while we are still waiting to get the final numbers to identify the leading cause of death in 2020, but we can safely estimate that COVID-19 will be the 3rd leading cause of death, only after cancers and heart disease. I want to pause here for a second and repeat. It is estimated that COVID-19 will be the 3rd leading cause of death, only after cancers and heart disease. We know COVID-19 related deaths are preventable. In order for anyone to die from COVID is that they have to acquire the disease first. The disease is acquired mainly through close contacts, generally within 2 meters, without appropriate personal protective equipment. If we follow the public health guidelines, which is pretty simple, stay home, always maintain at least 2 meters distance from everyone that do not live in your same house. Wash your hands thoroughly and frequently, stay home when you're sick, and do not go anywhere, do not see anyone. Wear a mask when physical distancing is not possible. Wearing a mask do not allow you to get close to anyone. I will repeat here again, wearing a mask do not allow you to get close to anyone. It is used as an additional layer of safety for those brief moments when you may accidentally come close to someone who doesn't live with you. We mentioned it before that death is a lagging indicator, and people shouldn't use that to assess the risk of COVID today. Unfortunately, the high case rates we are seeing right now will continue to result in people dying from COVID. We have to take actions now, every one of us, to prevent any further deaths in our region and prevent further spread of the disease. We must do, all of us, to protect all lives in our region, especially the preventable deaths. Thank you.
We'll now take questions from the media. Today we'll start with Blackburn.
Yes, good morning. I guess first off, you said that you would make a decision midweek regarding extending online learning for students. Has the decision been made, or are you just following the provincial orders at this point?
Well, all I can say is we have had some conversation with the ministry, and hopefully we are looking at the numbers very closely right now. I think the parents should think about all the possible options right now, and we are confident that we will share our final recommendation tomorrow. Some of this data is being finalized. Some of those conversations with different levels of the ministry have happened in terms of looking at the risks locally, but the final recommendation and data we will share tomorrow, and that would help us to give a firm answer to the community in terms of what to expect.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. The province yesterday announced that it intends to have all long-term care home residents and employees vaccinated in our area and other areas by January 21st. Do you think that's realistic, and are we going to be receiving more doses of Moderna vaccine in order to reach that goal?
So I'll just start. For our area, we do think it's realistic. We do have a schedule in place, and I'm talking specifically about long-term care homes. As we get the long-term care homes completed, we intend to go right into the retirement homes. And the vaccination, vaccine, we do have vaccine, and we anticipate we'll get more. So we think we're fine with the vaccine, allotment.
And as we know, we have many homes that do have active outbreaks. I'm sure a lot of people who do need acute care right now because of those outbreaks, will those people be able to be vaccinated in that time frame?
Yes, so this is Dr. Wajid Ahmed. Yes, I think so. And so what we have done is we have given our support and our the flexibility and direction in terms of what to do for the homes that are currently in outbreak. So as I reported yesterday, we have come up with our local recommendation in the absence of any central guidance and recommendations with respect to the homes that are currently in outbreak. So we have provided some of those parameters. We understand that some of these homes that are currently in outbreak may have some staffing challenges in terms of collecting all the background work and collecting the consents, getting their staff trained in the COVAX system for data reporting back to the ministry, and also the actual immunizers and maintaining the cold chain. We have been providing this direction. We are offering our support with the staff that we have appropriately. We have also asked the hospitals that are affiliated with all these long-term care homes to reach out to each of these homes because some of their staff are already there to offer their assistance in getting them up and ready to vaccinate. When we are talking about January 21st, and I think we reported that even before, that we are on track to even finish all of that pending that the homes are ready to vaccinate, even before that. And Teresa talked about a calendar and a schedule, but again, all of that is dependent based on the information that we have. If a home today, they say that we are ready, we have everything in place, and we want to go ahead and start the vaccination, we have no issues. We'll just basically, let them do what they need to do to get this everyone vaccinated. So we are looking at all the options. We are trying to provide all the support through the health unit, through the hospitals, and also getting them up and ready. So hopefully we should be able to finish vaccinating our long-term care home, at least the first doses, in even before the January 21 timeline that the province has announced.
Okay, thank you.
Any questions from AM 800?
Teresa, this goes back to my question yesterday in regards to those that decline the vaccine. If they have a change of heart and they want the vaccine, will the health unit go back into those homes?
So we are working with all of the homes, and we pretty well have like a little customized model for each home based on their needs and their schedules, their ability to get consent signed. So as you're aware, initially the health unit was going to be coordinating the vaccination of residents, and very quickly it became, the direction was that we could now include caregivers and the staff as well on site at the home. So as homes, they were prepared for the residents, we are getting requests as they get more consents, and so we anticipate that we will be delivering the vaccine and working with them to get as many people vaccinated as possible that want to be vaccinated. So we will continue to work with them, and that may mean an initial vaccine clinic, say, with primarily the residents and some staff, some caregivers, and then maybe another one with more caregiver presence and remaining staff. So we fully intend to work with them and get everyone vaccinated.
Okay, thank you. And then Dr. Ahmed, for the cases today, 170, obviously still very high, but lower than last week. I believe we're at 272 this time last week. Is there a delay in the results coming back, or do you think these numbers are accurate with obviously the holidays, with Christmas and New Year's?
Well, I think what we are seeing right now is still the impact of the holidays at this time. I'm not sure that if we're starting to see some of the impact on the New Year's Eve or New Year's timeline. We also heard from the survey that was done on Canadians in terms of their mobility, and half of those participants of the survey did report that they met with their family members. So we know that overall, not only here but maybe in other parts of the country, people had those type of meetings. So it's unfortunate, but I think we are now seeing the impact of those gatherings right now with the large number of cases. You're right in terms of the cases compared from last week, but again, I don't think that even 170 is a number where we should start to feel or think that we are in a better position, because these numbers change. These numbers can flip in a day, and tomorrow we can see a completely different number. So I don't want us to think that things are getting better. I think I want us to be very realistic in terms of what we are dealing with right now. We are not out of the woods yet, and I don't anticipate that we will be out of the woods, at least in the near future. So we'll have to hang on to what we are doing right now, and as difficult as it is, and I can assure you that I completely understand, and again, not only being as the medical officer of health, but also as a resident of this community, and with everyone, with friends, families, and everyone, I also suffer the same feeling with not able to meet people, not able to do the things that I used to do. But it is important that we recognize that we all have to do that, and that's the only way we can beat this. The vaccines are here. Once we vaccinate our long-term care home residents and staff and caregivers, we'll be moving out to the rest of the priority population depending on the supply of the vaccine. We already know 2 of the vaccines that are already here. The third vaccine, AstraZeneca, is approved in UK, so it's just a matter of time that it will be approved in Canada too. There are other vaccines that are in the pipeline too. So these are all good news that would help us move forward. But until we get that all of those things in place, I would still be very much concerned about the rates. Back in the summertime, even when with the worst days, we used to report cases between like in the 10s or in the 20s. Those were our daily averages. Now we are reporting on our daily averages between 150 to 200, and sometimes even more than 200. So I like to be optimistic, but I also want to make sure that we are all being realistic. Having 150 case or even 100 case, it's not okay. It's not something that we should accept. We should try our best to follow these guidelines and bring the cases back to where we were before in September, October, and on those timelines.
Thank you.
Any questions from CTV?
Yes, good morning. Are there any other measures that can be taken, or is it more a matter of people following the ones that are already in place?
Well, obviously, there are some of these public health measures. When they are put in place, their main purpose is to ensure the safety and well-being of individuals from a health perspective, because we are dealing with a pandemic, which is an infectious disease, and we know how infectious disease spread. So all these measures are put in place to protect the health and well-being, protect people from dying, protect people from getting hospitalized, and save lives. That's the primary goal. And then when we talk about the secondary goal, we talk about the social well-being, we talk about the mental well-being, we talk about the economic well-being. So it's a fine balance when we are talking about all of those measures that can be employed to protect our first goal, which is to save lives. And what can be done? There's always more that can be done, but some of these measures will also bring in some hardships, some other challenges when it comes to social well-being, economic well-being, mental well-being. So as difficult as these measures are, as difficult as these decisions are, I'm sure that our leadership, our politicians, our local health unit, and others are doing whatever they think that would help in achieving all of these objectives, not just one objective.
Great, thank you.
Any questions from CBC?
Yes, good morning. I just wanted to see if you could elaborate more on the vaccination process for homes that are in outbreak. Will it be the same process for homes that are not in outbreak, or will there be additional precautions being taken and so on?
Katerina, I don't know if I understand your question correctly. So we did provided some parameters in terms of who can get vaccinated and what would be the process that they will follow. It may not be the same, obviously, because we don't want people who are already exposed to the virus and to get the vaccine, because we don't know the efficacy of this vaccine, and we don't know how we can even differentiate if it was a vaccine failure issue, if it's a vaccine adverse event issue, or if something happens, then how do we report that? So I think there are some certain challenges, but despite those challenges, we put some good, strong recommendations in terms of what those parameters would look like. So for a resident, if you are at negative, and even if you are in the affected unit, you can get your vaccine. For any resident who's in the non-affected unit of a home in outbreak, they can get the vaccine, no issues. And anyone who was previously positive COVID cases were considered resolved, they can get the vaccine. So basically that leaves only the residents who have an active COVID disease, or resident who are suspected of COVID at this time, or anyone who fails the screener for COVID on the day of vaccination. They may not get the vaccine, but everyone else, they will still get it. And again, the goal is to minimize as much as possible any further spread and ongoing exposure as a result of COVID spreading in the home.
Sorry, I should have been a bit more specific. I guess I'm wondering, will the health unit team, the team of nurses that's been going into homes, is that going to be the same process, or will it be the staff at those homes? Like, are you limiting your entry into those homes, I guess is my question?
I can answer that. We are just working with the homes to determine what they need. So if they tell us they don't have enough nursing staff to administer the vaccine, we will be sending our nurses in to do that. So we are just working with individual homes based on the criteria that's been set out by Dr. Ahmed, and having those discussions with the home. And so if we're needed, we will be doing the vaccinations, doing whatever is necessary.
Okay, and what's the timeline for getting into the homes that are in outbreak? Are you doing the homes not in outbreak first and then moving on to homes in outbreak? We've heard from a couple that are in outbreak that they're expecting the vaccine next week, and I'm wondering if that's accurate.
Every home, we've just, we have a schedule, and we are working with all of the homes. So I do know that there's a blend, like homes that are in outbreak are getting done this week, and there could be, homes getting done next week based on their readiness. So, there's no separation of it. It's just that whenever they're ready. And the consents are a very important part of the whole process. So that can take a little bit more time, and if homes are in outbreaks and they need more communication with their family members or time to get the consent, then we will it might be delayed a bit, but we're hoping to just work with the homes as they're ready, but also trying to keep to very tight timelines.
Okay, thank you so much.